It is a high time that we should have a serious conversation around pediatric non-communicable disease. How common are these mental health conditions among children?
It is a grossly under-detected, under-reported problem, whether it's type 1 or type 2 diabetes. First, eating sugars does not lead to diabetes.
How is childhood obesity is critical?
The reason why children become obese, babies, fetuses who grow in an undernourished environment, when they come into the world and they are exposed to more appropriate nutrition, their body is not able to adapt to plenty. Recently, Lancet said that in India, by 2055, 1/3 of the population, Indian population, will be obese.
Oh. Each year, approximately 1.2 million people under age of 20 years die of non-communicable diseases, which accounts to 13% of NCD mortality. For Maharashtra, this number translates to 6 million children, which includes 2,000 new cases of type 1 diabetes, 20,000 new cases of congenital heart disease. The risk factors for NCD develops during the childhood. So with such alarming numbers, it is a high time that we should have a serious conversation around pediatric non-communicable diseases. Let us begin with what we know about non-communicable disease, that is NCDs. For those who are not aware, NCDs cause 2 in 3 deaths in India. In 2010, National Health Mission, understanding the need for non-communicable disease, has launched a program called NCDs, which covers 4 conditions: cancer, cardiovascular diseases, diabetes, and cerebral stroke. Over a period, the national program got evolved and has been expanded to cover more conditions like COPD or chronic kidney disease, non-alcoholic fatty liver disease, and many more. With Global NCD Week round the corner, which is an annual event celebrated in the month of September with a specific theme, this year's theme for Global NCD Week is "The Time to Lead is Now." We have with us Dr. Meenakshi Girish, who is Professor and Head of the Department of Pediatrics at AIIMS Nagpur. Welcome, Dr. Meenakshi.
Thank you. It's a pleasure to be here.
So, Dr. Meenakshi, to start the conversation, I really want to know from you, is it really a time to discuss about pediatric non-communicable disease?
Yeah, my answer would be a resounding yes, because since there is so much focus on adult non-communicable diseases, and as you rightly said, these adult non-communicable diseases are no longer limited by the age barriers. Pediatric non-communicable diseases is the right time to start talking about, and I would like to add that it is not just an extension of adult non-communicable diseases, because pediatric non-communicable diseases, they are distinct in terms of etiology, in terms of the presentation. So we may have diabetes in adults, but we also have diabetes in children. We may have, heart diseases in adults, but we also have heart diseases in children. But they are distinct in terms of how they occur in children and how they present.
So what brings me to the core question now is that are pediatric NCDs a health burden in that context? Because we are still grappling with many MCH conditions or maternal and child health conditions. With basic, the governments are struggling, many state governments are still struggling with reducing their maternal mortality and other things, or basic survival things. Is this a burden as yet, the pediatric non-communicable disease?
For decades since independence, we have seen that non-communicable diseases in children have been under-prioritized in national programs, and understandably so. But you see that all the efforts that the government has taken towards communicable diseases since independence, they are slowly bearing fruit. And I wouldn't say that non-communicable diseases have surpassed communicable diseases in terms of health burden, but they're not very far. We do have dramatic successes against communicable diseases, and I would like to recall the polio elimination that we've had just a decade ago. So we are getting the communicable diseases slowly under control.
So basically, government really need to invest into this non-communicable disease in children as well nowadays.
I would say another reason why the government should start looking at pediatric non-communicable disease is that it already has a very good program for adult non-communicable disease, like you said, the NCDs program. But you must understand that lot of adult non-communicable diseases have their origin in childhood.
Yes.
So for that reason, we have to start looking at pediatric non-communicable diseases.
We look at NCDs, we are dealing with wide spectrum of conditions, as mentioned, no? Because even in adult NCDs, there are cardiovascular disease, hypertension, diabetes, stroke, and n number of these. Like in pediatric cases also, there are these many conditions.
There are many non-communicable conditions in either age group, adult or pediatric. But we focus only on certain non-communicable diseases for two reasons. One is their impact on the individual in his or her life course. That means pediatric non-communicable diseases contributing to the burden of adult non-communicable diseases. The other reason why we look at non-communicable diseases in pediatrics are the importance of early detection and management, which can change the life of the child and make the child a productive, reasonably healthy adult. So for these two reasons, we have to look at non-communicable diseases, and those non-communicable diseases which are amenable to either prevention or modification of lifestyle.
From that point only, I wanted to actually ask, I was eager to ask you that thing, that how much of this risk can actually be prevented in children? Because we know and we talk often that if you have to prevent diabetes or hypertension, stop eating oily foods or start exercising, and that, so everything that adults try to impose on or start doing. So how much of this risk in pediatric patients can be actually reduced?
So some of the non-communicable diseases in pediatrics can be prevented through the same interventions by changing the lifestyle of individuals. I would like to name here obesity, mental health, and asthma. These can be modified through lifestyle changes.
What are other conditions you mentioned?
So other non-communicable diseases which have a genetic component in it and hence are not amenable to prevention, primary prevention. For example, type 1 diabetes. You have child developmental issues. Then you have congenital heart diseases.
Yeah.
So these are not very well amenable to primary prevention, but there's still a lot you can do.
So how exactly is type 1 diabetes different from type 2 diabetes?
When you see the blood sugar levels are high, it could be type 1, it could be type 2 at a particular age. The younger the child, it is more likely to be type 1. The older the child, more likely to be type 2. But having said that, we need to be very vigilant, because type 1 diabetes, what you have to tell the family is the treatment is lifelong insulin.
Yeah.
Not so for type 2.
So by default, if the child is diagnosed with type 1 diabetes, he has to be on insulin.
Absolutely.
There is
lifelong.
no medication.
There is
and
no
lifelong.
alternative.
That's a big
That's a big
challenge
difference between type 1 and type 2. Whereas type 2 intermittently may go off and on insulin.
And like for type 2 diabetes, like we do restrict many patients not to eat sugar and all those things. So does that mean that the child who is diagnosed with type 1 diabetes has to completely stop sugars?
What is important to convey to the public is that first, eating sugars does not lead to diabetes. Diabetes happens whether type 1 or type 2 because of metabolic deficiency in the body by which insulin does not do its work. Okay, so eating sugars do not cause diabetes. And once you developed diabetes, all the individuals, whether suffering from type 2 or type 1, have to remember that healthy diet is the key to healthy life.
Yeah.
So whether it is type 1 diabetes or type 2 diabetes, the entire family, whether you have diabetes or not, you have to eat a healthy diet in which sugars have to be minimized.
So a child who is diagnosed with type 1 diabetes is basically a normal child only. So he can eat everything that a normal child eats.
Absolutely. This is very shocking to hear most of the time when I say this, and I love to say this to the families when I diagnose type 1 diabetes, that your child can eat everything. So they're stunned for a few seconds.
Yeah.
What is childhood without sweets?
No, because this is a very common notion. Diabetes, no sugar.
Yep.
So
that is incorrect.
Yeah.
Particularly in type 1 diabetes, a child would love to attend birthday parties or share some sweets during festivals. So you should not deny them. What is more important is calculate the insulin dose correctly.
Is it life-threatening, type 1 diabetes?
I would say yes.
Okay.
Because unlike type 2 diabetes, there is a complication which happens in type 1 diabetes more commonly than in type 2, and that we call as diabetic ketoacidosis.
Oh.
And that can be life threatening.
Let us discuss something about obesity. So there are now the data says, WHO data says that there are 20% prevalence. There is a 20% prevalence of overweight and almost 8% obese children. So if I translate those, then the numbers are shocking, because in Maharashtra, in that case, there will be 6 million, that is 60 lakh children who are overweight, and almost 2.4 million or 24 lakh children which are obese.
I would like to quote Lancet here. Recently, Lancet said that in India, by 2055, one third of the population, Indian population, will be obese.
Oh, how is childhood obesity is critical?
So, childhood obesity also can lead to innumerable complications affecting almost every organ in the body. So, it is a deadly condition. Even though our mindset has not come around to accepting obesity as pathological, we still consider those children as chubby and healthy.
Yeah.
And even parents do not consider
It is very difficult even for the health functionaries to say your child is
Absolutely.
obese. No?
Absolutely.
Sometimes people don't take it in a good sense. They take it
Yeah.
otherwise. That how
Definitely,
can
it's
you
a
say?
sensitive thing, and there is a politically correct way of conveying that your child is not healthy, rather than using the word,
Yeah, obese.
the way it is. So that's where the challenge begins.
Yes.
First of all, to accept that there is obesity in the family, and it does lead to the same complication that adult
And then
NCDs are all
particularly
about. Before we move on to, I just want to add something about obesity.
Yeah.
There was an article published in a scientific journal, just I think in 2023. And what they said about childhood obesity was remarkable. The reason why children become obese, one of the reason is intrauterine malnutrition.
Yeah, exactly.
Right?
That's what I wanted
Children,
to point out.
babies, fetuses who grow in a undernourished environment, when they come into the world and they are exposed to nutrition, more appropriate nutrition, their body is not able to adapt to plenty.
So that actually highlights the point which I was thinking for a long time, that maternal nutrition does play a lot of role, and I really congratulate the government of Maharashtra who has initiated this whole Vatsalya program for
Yes.
preconception and early childhood development.
Yes.
So that's really commendable. Now, so how common are these mental health conditions among children? I'm saying children, but it's basically 0 to 19 age group. If you can elaborate on
I
that.
would say, as a pediatrician, and also based on what the literature says, mental health is what we see is only tip of a big iceberg. It is a grossly under-detected, under-reported problem, and there are articles which say that more than any other non-communicable disease in children, mental health leads to maximum adult non-communicable disease. Even cardiovascular diseases in adults are linked to early mental health, childhood mental health issues.
Yeah.
So it's a very common problem.
So because 1 in 7, that translates to almost 8% of prevalence, and if I again use
That is only that which is reported.
Yes, yes.
Telling
And
you
mental
that
health
it
is-
is largely
because the stigma
unreported,
is
and
large.
unfortunately, most parents do not consider their children's. Basically, what I want to say, children, when they have mental health issues, it is up to the pediatrician to identify it and to correctly manage it. Because children do not report anxiety as it is. They will stop going to school.
yeah,
They will
how to
start
pick those signs.
rebellions, which the parents, consider it as just being stubborn or just being lazy. They never report it to the pediatrician. And once they come to the pediatrician also says, oh, the child has nothing. It is just a mental issue.
Yeah.
That is also a problem. It has to be sensitively handled by the pediatrician, and the parents have to accept that going to a psychiatrist is not a stigma.
So because I am aware of anxiety, depression, but what all other conditions are there in, if we
So
have
when
to
we say
discuss the
childhood
spectrum?
mental health could include simple things like simple. I won't say simple, but things like anxiety, depression. Then there's something known as conduct disorders,
Oh.
which are more common in boys, where they have significant behavioral issues, which parents attribute to just being naughty, but they could be actual disorders which need to be
And which needs to
addressed.
be taken care early, otherwise then that will lead
Yes,
to
yes.
something.
As I
So,
said, mental health disorders lead to significant adult issues. So
no,
they
because
have to be.
many a times when parent goes to parent teacher meeting or something and teacher says that your child is not focusing on this or something. So can that be a sign of some kind of a
Absolutely.
this
Even children refusing to go to school, children frequently failing in school could be a mental disorder.
Yeah.
Right? So these things have to be picked up with a high degree of suspicion by the pediatricians, and the parents must readily go to the doctor to understand these issues, rather than saying that the child is lazy or the child is
And
too naughty.
unfortunately, we don't have any screening as of now for these kind of conditions in schools
We do
or
not.
anywhere.
We do
So
have
that's actually
we do have
sad.
programs in public health for mental health, but I think they need a lot of
No, I don't think.
revamping
Yeah,
to really
for
pick up
children,
the
yes, definitely.
mild cases. Yeah.
Now, so we are talking about schools. Let us also talk about the common condition. The weather is such now. Most of the children, they are coughing and sneezing, and that is one of the major reason for school absenteeism. That is what I've seen. I've experienced this in my home only. So how is that? So is that asthma, or is that recurrent cough and cold? So how, what exactly? Because you mentioned asthma as one of the NCDs, so I was worried whether my child has asthma or not, or that is just a cough.
So asthma is a label, and most parents are afraid of labels.
Yes.
Okay. So when a child comes with cough, recurrent cough and cold, the parents come and say, my child is getting every month, my child gets cough and cold, and please check his immunity. He must be having some deficiency of immunity. And that is where we start trying to tell them that what your child has is not a deficit in immunity. It is basically the response of the child's lungs to the environment, sort of a allergic disorder. Because of lot of reasons, some children tend to cough more frequently than other children, right? There's a very fine line between just having frequent viral infections, as most growing children face, or having actually asthmatic tendency.
No, exactly. So because no, many a times even doctors aren't aware of these things, and many general practitioners or some even pediatricians, they just keep on prescribing antibiotics which are not helping. And now even parents are concerned with multiple rounds of antibiotics given to children, because this is not one of episode; it's recurrent episodes that are happening. So I think diagnosing asthma is very
Diagnosing
critical.
asthma and considering it as an important non-communicable disease in children is very essential, because children do have a lot of school absenteeism because of this.
Yes.
And there is a certain way of asthma care pathway, which if followed, children will have a very good quality of life.
So like type 1 diabetes is a lifelong condition and child has to be on insulin for lifelong. In that case, if a child is diagnosed with asthma, does he have to be on
Lifelong.
nebulizers lifelong?
No, that is something that parents are always worried about. But I must say here that unlike type 1 diabetes, where insulin has to be given lifelong, asthma management lasts only for a few months, and children generally outgrow the tendency to react to the environment, and they don't need inhalers lifelong. Definitely no.
Okay. And one more question, sorry, but I am curious to understand this thing. Like, no, in Western countries now they have started exposing children to mud and all those things, whereas we Indians, we are trying to restrict children indoor. So does that early exposure to maybe triggers or stimulants or something can enhance and the body response or prevent these kind of things?
Yeah, so what you're talking about, something relates to that hygiene
Yes,
hypothesis,
hygiene hypothesis.
where you expose them as early as possible to allergens. they generally tend to adapt and they react less. It's that is one of the reasons why, certain dietary, like animal protein, is introduced even at 9 months. Earlier, they used to say that we should not introduce eggs or cow's milk till 1 year of age, but
that's not the case.
This is the reason why they should be introduced early.
Okay, now coming back to one more condition which you did mention, though it is the congenital heart disease, no? And I know that it is part of the program called as Rashtriya Bal Swasthya Karyakram, RBSK, where teams are screening children as early, even at birth, with a congenital heart disease, the septal defect or something. Because that is also an alarming condition. The prevalence is quite 8 to 10 per 1,000 live births is there, which again 20,000 children or newborns born with congenital heart disease. So what do you want to say about congenital heart disease? How is it different from other heart diseases in adults?
Yeah, so far we've been talking about heart diseases in adults, and we know that heart diseases in adults are largely because of modifiable lifestyle risk factors. Heart diseases in children, especially newborn and all, most of them, they are not because of preventable risk factors. They happen. There are multifactorial reasons why heart disease in babies happen. That cannot be prevented. But what can definitely be done is, in India, especially through the RBSK program, there are very good avenues for parents to get the heart disease in their babies corrected at the right time. Time is very critical. If the heart diseases can be detected and corrected at the right time, children can...
Yeah, timing, because when you say timing, I am pretty sure, because I've been observing this in the field and I'm seeing this, that teams are identifying the children, but somewhere families are reluctant to get their children operated, and they are losing that precious time somewhere, because functionaries have hard time convincing them that the surgery is available, surgery is safe, but somewhere heart surgery creates an alarm in minds of the parents or caregivers, where they feel that probably my child won't survive that surgery, and they are reluctant. So that is one probably hurdle.
I would say that, I agree with you that a lot of RBSK doctors, they try to convince the parents. They even give conveyance to the hospital from their homes. The government takes up the expense of doing the heart surgery. The family doesn't have to spend. Even then, families often refuse to go to the hospital for heart surgeries. I think largely it is because of the fear of unknown.
Yeah.
They would rather have the child with heart disease than face the unknown, where they don't know what the future is. Here I would like to just emphasize that there are very good pediatric cardiac surgeons in every city.
Technology has made advances, and the surgeries are quite safe.
Surgeries are very safe at the hand of very skilled surgeons. So I think people should take up the options available.
Now,
also I want to say that even picking up the congenital heart disease, echo is required, and that technical skill and the equipment may not be available everywhere, but there is a very simple screening available to pick up most of the congenital heart disease, and that is the pulse oximeter screening. I just want to emphasize here, everybody is familiar after COVID, particularly. So pulse oximeter, there is a algorithmic approach on how to detect congenital heart disease in neonates using the pulse oximeter, and this can be done by even nurses in the SNCUs. So this screening methodology through pulse oximeter should be popularized and should be taught to every primary care healthcare professionals, so that we can pick up.
So now disease. Taking from that point, when you say algorithm and SOPs and everything, I got that point. Now that was my next question to ask you, because UNICEF Maharashtra has a collaboration with your department at AIIMS Nagpur, where you have initiated with a NCD clinic, pediatric NCD clinic.
Yes. And
I have heard that there is a separate day for each of these conditions, 6 or 7 conditions, where children are screened and managed in a standard protocol way. So can you elaborate on that? How? Because you are the one who is leading that particular...
Yeah, so I just would like to say that we are running out of days. There are 7 non-communicable diseases, and we have to run them 6 out of 7 days. Yeah. But thanks to UNICEF collaboration, we have dedicated 1 day of every week to one non-communicable disease. And you will be surprised to know that I mean, this started recently. We have started since February, March 2025. The specialty non-communicable disease specialty clinics at AIIMS Nagpur. But I must say that it has changed the way we give care to children with specific non-communicable disease. And we see so many children attending those clinics in this short span of time, where earlier they used to come to our general OPD and we used to treat them as part of general OPD. And the care that we are able to give them now as specialty clinics, it makes a world of difference to the child as well and to the treating physician who is running that clinic that day.
Yeah.
You know, not everybody can become super specialist.
So we have clinic for type 1 diabetes, we have
Yes.
clinic for obesity, we
Yes.
have clinic for congenital heart disease, sickle cell disease.
Sickle cell
Oh,
disease.
yeah, sickle cell disease is also NCD.
It is. In Maharashtra, you
Yeah.
can't run a specialty clinic without having
Sickle
a
cell.
clinic for sickle cell disease.
Because sickle cell has been now, even central government has taken it in a mission
Yes.
mode to eliminate sickle
Yes.
cell anemia and all those things. Now we know that there are NCD clinics for adults. Can is there a scope for establishing a NCD clinic for children in district
I
hospitals?
am very confident and optimistic that we can have pediatric NCD clinics at every district hospital or at appropriate health centers in the public health department. And we could replicate the model that we are using at AIIMS Nagpur in public health, except that certain conditions require certain tertiary level interventions. But most of the 7 NCDs can be addressed at primary health level. For
Yes.
very few complications, they have to be referred to the tertiary care. So yes.
AIIMS can serve as a hub and then they can be spokes at the district
Absolutely,
hospital.
yes.
So that's a
Yes.
wonderful model. So as we close, Dr. Meenakshi, I would like to leave you with 3 key messages. If you have to give us 3 key messages, maybe for patients, caregivers, or functionary or policymakers for that matter, what those 3 messages could be for pediatric non-communicable disease care, prevention, and all those things.
I have a message for every stakeholder. For parents out there, I want to tell you, when it comes to pediatric non-communicable diseases, don't hesitate to reach out to the doctors, because most of the conditions, if intervened timely, they are modifiable. To the policymakers, we have a wonderful public health system. We need to empower the frontline workers with all the right information to address all the 7 conditions. We also need to have a very robust track and response system, because most of the pediatric non-communicable diseases are lifelong, so we need to have a surveillance system. And to the society in general, I would like to say that beware of the 3 major risk factors for the common non-communicable diseases, whether pediatric or adult. Physical inactivity, eating junk food or having unhealthy diet, and addiction. Addiction to food, addiction to drinks, addiction to social media. Thank you.
Thank you so much, Dr. Meenakshi. It was wonderful talking to you, and thank you because you have shed light on very key aspects of pediatric NCD, and particularly because this pretty much shows us why an inclusive, supportive, and responsive approach is required for pediatric non-communicable disease agenda. Thank you so much. So the youngest generation, the children and adolescents, we consider them as future, but they are very much our present, and we need to start looking at them right now. With this changing disease pattern or global health pattern, we need to keep the dignity and care of the children, and particularly adolescents and children, at the center for non-communicable disease as well. We need to put children at the heart of NCD agenda and mental health agenda. Thank you so much.